Hello, everyone, and thank you for joining us. Welcome to Patient Metrics Matter, industry benchmarks you should know. We're delighted that you chose to join us today to talk about what the future holds for dental professionals in the new year. I'll see you at the end of the presentation. Over to you, Ryan.
Thanks for the intro, Megan. So let's hop straight into our agenda for today. So we're going to cover an introduction to the data we pulled. We're going to talk about who we heard from. Then we're going to talk about communication methods and the different styles. Then we're going to go into texting with your patients, followed by recall rates and successes, confirmation rates, new social reviews, survey response rates, and the favorite one, time and cost savings. And then we're going to dive into our report. So first of all, a little bit about me. My name is Ryan, as Megan mentioned. I'm the Vice President of Customer Experience here, and also investor to different businesses. So metrics really matter to me and they excite me, which I think everyone in this audience will be excited about what we present today. Why I joined Intiveo quickly? Well, I'm a patient myself. If you think about it, everyone watching should be a patient. We should all be going to the dentist, obviously. And for me, patient experience really hit home on some examples I'm going to cover a little bit later. But I'm passionate about changing the healthcare industry, changing it to bring it up to speed into where other forms of communication and engagement and the experience is today. And there's so much room for improvement. So enough about me. Let's dive into a little bit about using data and success metrics to enhance patient care. So every dental professional, every dental and oral surgery practice staff member who's watching this right now, they have to ask themselves, and we have to ask ourselves, how to engage meaningfully with their patients. And perhaps more importantly, we all need to ask ourselves, how are we going to measure if that engagement is successful? So to support dental professionals in answering that very question, we published a benchmark report last week entitled Dental Patient Engagement in 2024 Benchmark Report. So the report uses accumulative data from over 1,700 different dental and oral surgery practices from June 2023 to June 2024. So today we'd like to talk a bit about how you can use metrics like the ones in this report to inform you how to enhance patient care. But before we do that, let's chat briefly about what kinds of dental and oral surgery practices are included in the report. So first we've got enterprise. Now this category encompasses dental schools, dental service organizations, multi-location practices of more than 10. But do note this, that due to the differences in how some enterprise or dental services organizations operate, not every report will include this segment. Then there's general. So the general category comprises of general practitioners of dentistry. Then you've got oral surgery. Now this category includes OMS practices exclusively. And then you've got specialty. Now this category just looks at non-OMS specialty practices such as endo, ortho, pediatric, for example. And then we actually separated out those in Quebec. Now often the province encounters specific laws governing to patient engagement and communication. So we wanted to carve that out as its own unique segment. So this brings us to our first metric, how patients like to communicate. So communication methods. There's three main communication methods that we all know about: voice memos, email, and text. Understanding what methods patients prefer to communicate with, it can really help you build your patient engagement strategy. Now, whether your patients prefer automated voice messages, emails, or communicating by text, knowing this information allows you to plan your patient engagement strategy around how your patients want to be communicated. Now, if your patients are most commonly communicating by text, for example, sending educational materials by email, it's probably not going to be that meaningful. Plus, if you want to move your patients into one specific method of communication, we need to know where they're at and how they want to communicate. So this bar graph is the monthly average of number of messages sent in the last 12 months, whether that's an automated voice message, an email, or a text message. Now, the donut graph is a breakdown of the communication methods used over the full 12-month period. Now, what we see in this report is that texting, no shocker, is the preferred method of communication by the majority of dental and oral practices in our data set. as opposed to an automated voice message or email. Now, this indicates a common trend that we hear a lot about with conversations with our customers. Now, patients often prefer the convenience of texting with their dental or other healthcare providers on their phones. One of the biggest advantages of text is that it makes both healthcare provider and the patient accessible to each other. So texting with your patients. Now, because obviously texting is so important, we decided to take a bit of a closer look at how texting is being used, which brings us on to our next metric. Chatting with your patients by text. Now, this is our first metric, average text messages sent. So the number of texts between a dental or oral surgery practice and their patients, it can tell us a lot. Through texting, your practice can increase your patient's access to you. And it offers an opportunity for your practice to be quite responsive. Now, this metric also matters because it indicates a fair amount of patient involvement. Higher levels of text tells us that practices are communicating with the patients frequently. So, chatting with your patients by text, our second metric, the average number of patients texted. This metric tells us something different than the total number of texts. Now, it might be tempting to assume that this tells us how many patients each location sees, but many patients still prefer email or telephone, so they won't be captured in this number. Now, this number will tell us a lot about how many patients have chosen to text specifically. Now, as you saw previously, text messaging is the preferred method of communication. The bar graph on the left is the monthly average number of patients texted by a single dental practice to all their patients over a 12-month period. The bar graph on the right is the monthly average number of text messages sent by a single dental practice to all their patients over a 12-month period. Now, naturally, the French category, this encompasses several different types of practices. So to be honest, it's no real surprise that we should see more messages sent by this category. Now, of the other three categories, we can see that the specialty category is sending messages far more frequently, which makes sense given the messaging cadence that is needed for such a complex procedure, from fasting to pre-medication reminders and much more. So recall rates and successes. So see your patient's investment in action. Okay, so recall successes and recall rates, this really tells us a lot about patient engagement for several reasons. Recall successes and recall rates indicate that patients are invested in their dental health because they're coming to those recall appointments. Now, it also indicates that dental and oral surgery practices are successfully educating patients about the importance of oral health, or they are otherwise engaging with them in a way that brings home the importance of that recall visit. Now, it indicates that patients are satisfied enough with the healthcare they receive to be a returning patient. So on the left, we see the monthly average number of recalls successfully booked at a practice during a 12-month period. On the right, the yearly average recall rate is the number of recall appointment reminders sent divided by the number of recall successfully booked over, again, that 12-month period. So the higher the recall success rate for OMS and specialty really shouldn't surprise us. After all, oral surgery and other specialty procedures, it often involves so many more follow-up appointments. So the positive result here is the patients, they are engaged. They're returning for their recall appointments, indicating that both their investment and that the practice is communicating effectively. Now, we also saw that of all the data set, that texting is and was the preferred method to achieve a high recall success rate. So, confirmation rates. So, a tangible measure of your patient's commitment. Now, a solid confirmation rate, really indicates patient commitments. Now, it's likely that they're sending the right amount of reminders and appointment information. Higher confirmation rate obviously should correlate with a no-show rate. The graph displayed here is the yearly average confirmation rate for a single practice over a 12-month period. Now, to put this into context, this means that about 4 out of 5 patients are confirming appointments across these practices. Now, this really indicates that practices can fairly accurately predict who is coming to their appointment. Now, it also shows a successful part of the patient engagement is making confirmation accessible, utilizing phone, text, and email The practice is able to meet patients where they're at by communicating in the way that they would prefer. New social reviews is our next metric. So patients are your greatest source of both advocacy and feedback. Now, I want to pause for a second and ask everyone watching, have you ever purchased anything on Amazon? I have. Okay, one of the things you look at is reviews on a product. There's a certain number of reviews where it gives you a bit of a tingle in your belly. I shouldn't buy it. It's 2 stars out of 5, for example, with a low number of reviews. So this is happening in our personal lives every single day. So your patients really are your greatest source of advocacy and feedback. So the majority of patients who leave reviews will leave positive ones. A high number of social reviews indicates happy patients. They feel positive enough about your dental or oral surgery practice to leave a review. Now, this is a key metric because it tells you how happy your patients are. And it gives you a good sense of how likely your practice will be trusted and chosen by prospective patients. On Google, for example, the Spiegel Research Center found that businesses with an average review rating of 4.2 to 4.5 stars, they are the most trusted. So in this graph, we see the yearly average number of social reviews at a single practice over a 12-month period. Now, these are an example of positive new social reviews. Now, if we consider that a general trend of between 35 and 60, and the most patient reviewers are writing positive reviews, that bodes well for moving up in the algorithm with a positive star rating. So this averages out to 3 to 6 new reviews per month. Survey response rates. You can utilize surveys to get a much clearer picture of where the patient experience is at your dental practice. It gives you the ability to identify kind of common trends and, importantly, areas of improvement. But it's really hard to know what your patients are thinking if no one responds. And this is why a survey response rate is such a key metric. The higher the response rate, the more accurate your information will be. I'm going to give you a personal example here, actually. I used to live in East London and then I moved to West London. So naturally I changed dentists. It was 5 tube stops to go back to my previous dentist. Went to a new dentist, walked in, experience wasn't great. Not the friendliest staff. Didn't know I was coming, I had to look it up, even though I had a confirmed appointment. And then I sat down, there was kind of like garden furniture to sit on. The paint was peeling off the wall. So I did my appointment and I never went back. I was due to go back 2 weeks later. And I made an excuse. I went back to my other dentist, 5 tube stops away. And really, I didn't have the time at that time to go into detail why I didn't want to come back. And I never received a survey about it. And I probably would have replied via a survey. And then they know how I felt. So looking at this graph this graph features the yearly average survey response rate at each practice within the 12-month period. Now, the chart gives us a good benchmark survey response rate for the practices in this report. And to put it into perspective, Becker's DSO and Dental Review reported that in 2022, dentists had an average of 3,798 patient visits. Now, if a dental or oral surgery practice sends out a survey after every appointment, even at the lowest number on this chart, which is 4%, that's 152 responses. Now, this provides these practices a very strong data set and kind of facilitates that strategy for how you enhance your patient care. Back to my example, imagine if they got 20 people that said paint peeling off the wall, staff weren't friendly, chance to re-educate the staff. Slap a little bit of paint on the wall, for example. So even with a low percentage, your practice has the ability to gather quite a lot of useful information. So time, cost, and savings. As we approach this final metric, we wanted to look at this slightly differently. So I'm going to explain to you, first of all, some customers of ours' experience in time, cost, and savings. So first one I'll pick here is Slippercoff Dental Centre. General practice. They reported and tracked that we saved them 3 hours a day in time saving, for example. And you've got SVSA, which is an OMS practice, roughly 2 hours a day in time saving using a patient experience platform. Another example is Dalton Oral and Surgery, 6 hours a day in time saving. So for reference, this is time and cost saving reported when switching to a patient engagement software. So ultimately, time saved converts into cost saved. So let's consider what staff might be present at a dental and oral surgery practice on a day-to-day basis. Usually you've got the dentist, you've got oral surgeon, a specialist, office administrator, manager, dental assistant, hygienist, the office reception staff. There's a whole team behind, these appointments. So considering if we look at the average salaries per hour of all these staff members, we estimate the cost of the staff per hour at your practice to be on the graph you see above. So just to pick an example, roughly, an OMS practice is $317 per hour if you accumulate all those, added up costs and staff, and in Canada, $257. So the averages per specialty. So if we take an average from the dental and oral surgery practice that we've spoken to directly, we learn that these averages total daily time savings. Now, across all practices, regardless of specialty or geographical location, the average was 4.6 hours. Now, let's take a look at that breakdown on the slide. And these are significant savings. So for example, OMS, we can, on average, patient experience platform would save them 2.5 hours, which daily cost in the US, based on what we saw in the previous slide, is $792 a day. So I'm going to extrapolate this a little bit further. Now, if you take these daily averages into consideration, we see what we can happen in a month. Now, yes, you are reading this right. Based on the time and cost saving we're seeing after making the switch to patient engagement software, general practices, for example, they could save as much as $20,000 in Canada a month. I pause there on purpose because it's quite a dramatic ROI for deploying the patient engagement software. So this is one of the ways that you can measure the success of your strategy. So to conclude, we'd love to give you all early access to the Dental Patient Engagement in 2024 benchmark report. Inside, you'll find all the metrics we discussed for your reference, and we're really glad you tuned in today to learn more about how you can leverage success metrics to strategize and gain insights into your practice.
Thank you so much for hosting, Ryan, and to all of our viewers, please expect a link to the last 12 months in dental patient engagement benchmark report in your inbox shortly. We'll see you all again. Thank you. Bye.